A 1-month-old has been forceful vomiting for the last 5 days after meals. His temperature is 100 degrees Fahrenheit, pulse is 135, and blood pressure is 80 over 40. Which of the following sets of serum findings is most likely in this newborn at this time? Now, this patient is presenting with signs of pyloric stenosis. Pyloric stenosis is going to be caused by hypertrophy of the intercircular layer of the muscularis propria. Now, here's the stomach, here's the duodenum. And because we have hypertrophy of this layer, food is not going to be able to enter the duodenum from the stomach. As a result, food is basically going to keep on accumulating in the stomach. And ultimately, this increases the pressure within the stomach. Now, in order to relieve this pressure in the stomach, patients are going to vomit. And so this is why we get vomiting after meals, is because when we eat food, it keeps on accumulating in the stomach. That increases the pressure in the stomach. And in order to relieve that pressure, we're going to vomit. Now, a question for you is that will this vomit contain bile? The answer is no. Because remember, bile is going to enter the intestine in the second part of the duodenum. So because we're not in the duodenum, the vomit is only going to contain non-bilious substances. Now, because we're losing so much fluid due to vomiting, we would expect the sodium levels to be low. As a result, we can cross out answer choices F, E, as well as D. Now, remember that the stomach has acid in the form of hydrochloride. When we vomit, we're also going to be losing HCl. When we lose hydrogen, this is going to increase the pH in the body, so we're going to have metabolic alkalosis. If we lose chloride in the vomit, we're going to have hypochloremia. And so we would expect the chloride levels to be low. And if you look at the answer choices, we can cross out answer choice B. Now we're left to answer choice A and answer choice C. Now answer choice A has potassium levels that is in the lower end with 3.2. Answer choice C is a little bit higher. Now remember that because we're vomiting so much, we're going to be losing a lot of fluid. And when we are in a hypovolemic state, the renin-angiotensin-aldosterone system is going to be activated in the body. And so aldosterone is going to have effects in the collecting duct. In the principal cell, it is going to stimulate the sodium and the potassium channels. So because of this stimulation by aldosterone on these channels, we're going to be losing potassium. So we would expect potassium levels to be in the lower end. Now remember that aldosterone is also going to be stimulating the hydrogen ATPase found in the alpha intercalated cell. And when we excrete out hydrogen, this is going to, in return, stimulate the activity of the bicarb chloride exchanger, and so we're going to be reabsorbing bicarb. And as a result, we would expect the bicarb levels to be in the higher end. And so the answer choice that is going to be consistent with all of this is going to be answer choice A, which is going to be the correct answer. I hope this video helps. Thank you for your time.